Hi, I'm Veronica Sapp with Castling. Is your hospital or imaging facility looking to invest in a new CT scanner? If so, the number one question you probably have in mind is, how much does a CT scanner cost? You'll start to consider variables like imaging capabilities, workflow efficiency, and patient experience while crunching numbers tied to cost. In this video, we'll explain the different factors that go into the final cost of your CT system and help you get a better idea of how much you can expect to pay. First, there are 3 tiers of CT scanners you'll be choosing from: low range, mid-range, and high range. Let's look at what you can expect at each of these pricing tiers. Low-range scanners typically take 4 to 16 slices and tend to be more affordable. They're suitable for smaller healthcare facilities that perform routine imaging and manage lower patient volumes. Cost increases for mid-range and high-range scanners, but so does imaging quality and scan speed. Mid-range scanners typically take 32 to 128 slices and are a good fit for medium-sized hospitals and imaging centers with moderate patient volumes. And finally, high-range scanners typically take 256 or more slices and make sense for large hospitals where high throughput is essential. Now that you understand the 3 pricing tiers of CT, it helps to take a closer look at the difference between single-source and dual-source scanners. CT scanners leveraging a single X-ray tube and detector to capture images are single-source CT scanners. They're most cost-effective, widely available, and are an optimal choice for facilities that perform routine imaging with a smaller budget. Dual-source CT scanners have 2 sets of X-ray tubes and detectors at different angles, allowing for advanced imaging techniques and superior resolution. While you can expect to pay more for these, they can be a worthwhile investment for specialized imaging centers with more challenging and consistent diagnostic scenarios. Another feature that affects cost is photon-counting, a major CT advancement that delivers enhanced image quality at a lower radiation dose by detecting and counting individual photons. This groundbreaking technology was approved by the FDA thanks to the rollout of the Neotome Alpha CT from Siemens Healthineers. Achieving this level of reliability and performance in CT equipment requires advanced manufacturing techniques, materials, and production, understandably leading to a higher price tag. There are a few other things that will affect cost, starting with the integration of artificial intelligence. While you can expect to pay more for AI capabilities, the reduced scan times and increased throughput resulting from this software could also help you recoup your investment faster. Bore size and table load may also add an additional cost. Bore size can range anywhere from 35 to 82 centimeters, while table load can range from 450 up to 677 pounds. The higher these numbers are, the more patient-friendly the CT equipment design is, but you could also be looking at a higher cost. The upfront cost for these features makes sense for centers that treat obese patients, as well as for trauma, orthopedic, or interventional procedures. But there's also a case for facilities to invest in these features to generally reduce anxiety for patients and minimize any need for repeat scans. That's less radiation exposure for patients, and it helps you maximize your appointment and scan volume. Some CT scanners come with provider-friendly features as well, like mobile workflows. Mobile workflows let staff spend more time in the exam room with patients. One example is with the Somatome GoTop CT system from Siemens Healthineers. It offers users a tablet and remote control to control the machine and process and examine images. While priced higher, it's important to consider the space savings mobile workflows offer. When you don't have to worry about a separate control room, you can free up that real estate for other uses while saving on utility bills. As we've highlighted, CT scanner cost depends on several variables. Its number of slices, whether it's single or dual source, and the patient and provider-driven features it includes. To answer the question that brought you here in the first place, there are a range of costs you can expect for a CT scanner. These costs account for installation, however, service and maintenance contracts are additional and priced out per year with regard to types of coverage, location, etc. Low-end CT scanners will generally cost upwards of $350,000. Mid-range CT scanners range from $400,000 to $750,000. For a high-end single-source system, $1 to $2 million is a likely investment. And finally, for those looking for the best of the best, an upper-end dual-source scanner starts at around $2 million, but can surpass $5 million if you're interested in photon counting and dual-source equipment. Thank you for watching this video. If you enjoyed what you saw here, please remember to like and subscribe to Castling. Follow us on social media, and for more information about CT scanners and the cost of a CT, visit castling.com/CT.